Namaste students, myself Dr. Jyoti Yamgal, Assistant Professor, Department of Rajna Shari, Jyoti Vidyapeeth, Women's University. In previous session, we talked about the surface marking and anatomy of the pleura. So, after this full description of pleura, we will continue to the lungs. So, the today's topic is surface marking and anatomy of lungs. The lungs are a pair of respiratory organs situated in the thoracic cavity. Each lung imaginates the corresponding pleural cavity. Now we will see the features of lung. So each lung is conical in shape. Here we can see in this diagram there is a conical shape of the both lungs. There is apex. This is the apex part of the lung. The base. This one is the base of the lung. Border. And there are three borders: interior, posterior, and inferior. So this is the interior. This one is the posterior, and this one is the inferior. There are two surfaces, which is the costal and medial. So this surface is related to the costa or the roots. So this is the costal surface, and on the medial surface, this is the medial surface, which also divided into vertebral part. And the vertebral part is related to the rib vertebra, and the mediastinal part related to the mediastinum of the heart. So the upper end, apex is the upper end, base resting on the diaphragm. Here it comes diaphragm, and the border are three: interior, posterior, inferior. Surface are two: costal and medial. The medial surface further divided into vertebral part and mediastinal part. Now we will talk about the surface marking of the lung. So first we will see the apex of the lung. And the apex of the lung is related to the clavicle. And the anterior border of the anterior border of the right lung, which is related to the sternoclavicular joint, the sternal angle, and this sternal joint. So the apex of the lung coincides with the cervical pleura. We will talk about cervical pleura in previous lecture, and is represented by a line convex upward rising 2.5 centimeter above and 2.5 centimeter above the medial contour of the clavicle. The anterior border of the right lung. This is the anterior border of the right lung. Correspond very closely to the anterior or costo-mediastinal line of the pleura, and is obtained by joining of a part at the sternoclavicular joint, another point in the median plane at the sternal angle, and the third point in the median plane just above the deep sternal joint. The anterior border of the left lung corresponds to the anterior margin of the pleura up to the level of the fourth costal cartilage. In lower part, it represents a cardiac notch of the variable size. From the level of the fourth costal cartilage, it passes laterally for 3.5 centimeter from the sternal margin, and then curve down and medially to reach the sixth costal cartilage. 4 centimeter from the median plane. In the region of the cardiac node, the pericardium is covered by only double layer of pleura. The area of the cardiac node is dull on percussion and is called the area of superficial cardiac dullness. This is the area of superficial cardiac dullness. Anterior border of the left lung, we talk about the anterior border of the left lung, which is related to the up to the level of fourth costal cartilage. The lower border of the left lung, which is related to cardiac notch and fifth costal cartilage. And the lower border of the each lung is related to sixth rib, eighth rib, 10th rib, and 10th thoracic spine. So the lower border of the each lung, lies 2 ribs higher than the pleural deflection. It crosses the sixth rib in the mid-clavicular line. Sixth rib in the mid-clavicular line. The eighth rib in the mid-axillary line. And the 10th rib at the lateral border of the erector spine. And ends 2 cm lateral to the 10th thoracic spine. Now, posterior border of the each lung is related to 10th thoracic spine, oblique fissure related to 3rd thoracic spine, 5th rib, 6th costal cartilage, horizontal fissure related to 4th costal cartilage, and 5th rib. So the posterior border coincides with the posterior margin of the pleural deflection, except that it is lower and lies at the level of 10th thoracic vertebra. The oblique fissure can be drawn by joining a point 2 cm lateral to the third thoracic spine, another point on the 5th rib in the mid-axillary line, and a third point on the 6th costal cartilage, 7.5 cm from the median plane. The horizontal fissure is represented by a line joining a point on the anterior border of the right lung at the level of 4th costal cartilage and a second point on the 5th rib in the mid-axillary line. Now the lungs. The lungs occupy a major portion of the thoracic cavity, leave little space of the heart, which excavate more of the left lung. The two lungs hold the heart tight between them, providing it the protection in rightly detached. There are 10 bronchopulmonary segments in both the lungs. The lungs are a pair of respiratory organs situated in the thoracic cavity. Each lung invaginates the corresponding pleural cavity. The right and left lung are separated by the mediastinum. The lungs are spongy in texture. In the young age or the young person, the lungs are brown or gray in color. Gradually they become mottled black because of the deposition of carbon particles or deposition of inhaled carbon particles. The right lung weighs about 700 grams. It is about 50 to 100 grams heavier than the left lung. The apex is blunt and lies above the level of the anterior end of the first rib. It reaches nearly 2.5 centimeters above the medial length of the clavicle, just medial to the supraclavicular fossa. This and left line. This is the anterior border. This is costal surface. This is the apex part. This is the hilum of the lung. This one is bronchus. We will talk about the content of hilum in further PPT. The pulmonary artery. This is the posterior border. This is the mediastinal surface. This is inferior border which is related to the diaphragm, or this is the base or diaphragmatic surface. It is covered by the cervical pleura and by the suprapleural membrane and is grooved by the subclavian artery on the medial side and in front. The base is semilunar and concave. It rests on the diaphragm, which separates the right lung from the right lobe of the liver and the left lung from the left lobe of the liver. The fundus of the stomach and the spleen. Borders. So we will see earlier that each lung has three borders: anterior, posterior, and medial. So the anterior border is very thin. It is shorter than the posterior border. On the right side, it is vertical and corresponds to the anterior or posteromedial spinal line with the pleural dissection. The anterior border of the left lung shows a wide cardiac notch below the level of the fourth costal cartilage. The heart and pericardium are uncovered by the lung in the region of this notch. There, the heart and pericardium are uncovered. The posterior border is thick and ill-defined. It corresponds to the medial margin of the crest of the rib. It extends from the level of the 7th cervical spine to the 10th thoracic spine. Its inferior border separates the base from the costal and medial surface. Now we will see the surface of the lung. There are two surfaces, costal and medial end. Costal and medial surface, then also further divided into two surfaces, vertebral part and the mediastinal part. Now the costal surface is large and convex. It is in contact with the costal pleura and the overlying thoracic wall. The medial surface is divided into a posterior vertebral part and an anterior or mediastinal part. The vertebral part is related to the vertebral body, intervertebral disc, the posterior intercostal vessels, and the splenic lymph. The mediastinal part is related to the mediastinal septum and shows cardiac impression, the hilum, and a number of the elevations which differ on the inside. This is the right lung. How we identify this lung? Because it has two fissures. This is the horizontal fissure. This is the oblique fissure. This is the superior lobe, inferior lobe, and middle lobe. This is the hilum of the right lung. In this diagram, there is only one fissure called the oblique fissure, which divided right lung into superior lobe and inferior lobe. This is a small part called lingula, which corresponds to the medial lobe of the right lung. Structures related to the mediastinal surface. So we can see in this diagram that there is some structure which is related to the mediastinal surface. Bronchus, pulmonary artery, veins. On the right side, we can see the right atrium and left ventricle and left auricle. And on the left side, you will see the left ventricle, left auricle, infundibulum, and adjoining part of the right ventricle. Auricle, right auricle, auricle, infundibulum, and adjoining part of the left ventricle, left auricle, infundibulum, and adjoining part of the right ventricle. A small, and on the right side, we will see a small part of the right ventricle, and on the left side, we will see the pulmonary trunk. On the right side, we will see superior vena cava, and on the left side, we will see arch aorta. On the right side, we can see the lower part of the right brachiocephalic vein, and on the left side, we will see descending thoracic aorta. Right side, the gyrus vein. Left side, left subclavian artery. Right side, esophagus. Left side, thoracic duct. Right side, inferior vena cava. Left side, esophagus. Right side, trachea. Left side, left brachiocephalic vein. Right side, right vagus nerve. Left side, left vagus nerve. Right side, right sphenic nerve. Left side, left sphenic nerve. Now, the right lung is divided into three lobes: upper, middle, and lower, by two fissures. We will see in the previous diagram the oblique fissure and the horizontal fissure. The left lung is divided into two lobes by the oblique fissure. The oblique fissure cuts into the whole thickness of the lung except at the hilum. It passes obliquely downward and forward, crossing the posterior border about 6 cm below the apex and the inferior border about 5 cm from the medial plane. Due to the oblique plane of the fissure, the lower lobe is more posterior and the upper and middle lobe are more anterior. In the right lung, the horizontal fissure passes from the inferior border. The horizontal fissure passes from the anterior border up to the oblique fissure and separates a wedge-shaped middle lobe from the upper lobe. The fissure runs horizontally at the level of the four costal cartilages and meets the oblique fissure in the mid-axillary line. The tongue-shaped projection of the left lung below the cardiac node is called the lingula. It corresponds to the middle lobe of the right lung. The number of lobes may vary in either lung. The right lung may have only two lobes, upper and lower, and the left lung may have three lobes. Accessory lobe may also be present. The lungs expand maximally in the inferior direction because movement of the thoracic wall and diaphragm are maximal towards the base of the lung. The presence of the oblique fissure of each lung allows a more uniform expansion of the whole lung. Root of the lung, or we also call it hilum of the lung. Root of the lung is a short, broad pedicle which connects the medial surface of the lung to the medial xylem. It is formed by structures which either enter or come out of the lung at the hilum. The root of the lung lies opposite the bodies of the fifth, sixth, and seventh thoracic vertebrae. the root of the lung. This is the pulmonary ligament. We will talk about the importance of pulmonary ligament in pleura. So, to see the importance of the pulmonary ligament, see the previous session on the basis of pleura. Now, the contents of the root. The root is made up of the following structure: principal bronchus on the left side, and eparchial and eparchial bronchi on the right side, then one pulmonary artery, two pulmonary veins, superior and inferior, bronchial artery, one on the right side and two on the left side, bronchial vein, anterior and posterior pulmonary plexus of the lung, lymphatics of the lung, bronchopulmonary lymph nodes, areolar tissue. Now the arrangement of the structures in the root. From before backward, it is similar on the two sides. Superior pulmonary vein, pulmonary artery, bronchus, from above downwards. From above downward, it is different on the both sides. So, on the right side, first one is the partial bronchus, then pulmonary artery, then the partial bronchus, then inferior pulmonary vein. And on the left side, there is first one is on the above, there is pulmonary artery, then below bronchus, and then below the bronchus, there is inferior pulmonary vein. Now the relation of the root. Anteriorly, common on the two sides, which is phrenic nerve, pericardiophrenic vessels, anterior pulmonary plexus, and on the right side, and the special relation on the right side, anteriorly is superior vena cava and a part of the right atrium. On the posterior relation, a common on the both sides is Rufus nerve on the posterior pulmonary plexus, and on the left side there is descending thoracic aorta. Superior relation, on the right side there is terminus arter pagidus vein, and on the left side there is arcus aorta. Inferiorly pulmonary ligament. This is the relation of the right lung. This is the posterior aspect and the relation of the lung to the surrounding structures. This one is the superior vena cava. This is the bronchus, the posterior. This one is the bronchus. This is the esophagus. This is the agigus vein. This area is related to the heart. These are the pulmonary veins, pulmonary artery, left brachiocephalic vein, right brachiocephalic vein, subclavian vein, subclavian artery. The anterior view on the left side, and this is the posterior side. This is the first view. Here, this is the anterior side. This is the posterior side. The aortic arch of aorta. This is the descending thoracic aorta, esophagus, bronchus, pulmonary artery, pulmonary vein. This area is related to the heart, stem, left subclavian artery, left subclavian vein. Now the difference between the right and left lung. The right lung, it has two fissure and three lobes. On the left side, it has one fissure and two lobes. Right side anterior border is straight, and the left side anterior border is obstructed by the cardiac nerve. On the right side, the right lung is larger and heavier, and it weighs about 700 grams. And on the left side, it is smaller and lighter, weighs about 600 grams. The right lung is shorter and broader, and the left lung is longer and narrower. Now the bronchial tree. The trachea divides at the level of the lower border of the fourth thoracic vertebra into two primary principal bronchi, one for each lung. The right principal bronchus is 2.5 centimeter long. It is shorter, wider, and more in line with trachea than the left bronchus. Left principal bronchus is 5 centimeter. It is longer, narrower, and more oblique than the right bronchus. Bronchopulmonary segment. The definition is these are the well-defined autonomic, anatomic, functional, and anatomical, functional, and surgical structure of the lung. Each one of which is separated by a tertiary or segmental bronchus, and then the each segment is pyramidal in shape, with its apex directed downward and directed towards the roof of the lung. There are 10 segments on the right side and 10 on the left side. This is the trachea. This is the right main bronchus. This is the left main bronchus. Now it is divided into lobar bronchi, then segmental bronchi. The microscopic view of the section of this area. This is the branch of the pulmonary artery. This is the lateral bronchopulmonary segment in the middle of the right lung, and this is the medial bronchopulmonary segment of the middle lateral of the right lung. Now the bronchopulmonary segment. On the right side, there are three lobes, upper, middle, and lower. On the upper side, it is apical, divided into three segments: apical, posterior, anterior. On the middle lobe, it is divided into lateral segment and medial segment. And the lower lobe, it is divided into five segments: medial, anterior basal, posterior basal, lateral basal, medial basal. Left lung has two lobes on the upper and lower. The upper lobe is related to the apical segment, and it also divided into upper division and lower division. The upper division is related to the posterior and anterior segment. The lower division is related to the superior lingular, inferior lingular. The lower lobe is divided into superior, anterior basal, posterior basal, lateral basal, and medial basal segment. Here is the diagram of the bronchopulmonary segment. This is the apical. This is the superior lobe. This is the apical, anterior, posterior, superior segment, medial, anterior basal, lateral basal, posterior basal, and same on this area. The anterior side, and the medial view, and this is the lateral view. There is medial basal, posterior basal, superior segment, apico-posterior segment. Now clinical anatomy. Usually, the infection of the segment remains constricted to it, although some infections like tuberculosis may spread from one segment to another. Knowledge of the detailed anatomy of the bronchial tree helps considerably in surgical removal of the segment or segmental resection, drainage of lung abscess or bronchiectasis by making the patient adopt a particular posture called the postural drainage. Visualizing the interior of the bronchi through an instrument passed through the mouth and trachea. The instrument called a bronchoscope and the procedure is called the bronchoscopy. So, the instrument which used to visualize the interior of the bronchi is called the bronchoscope, and this procedure is called the bronchoscopy. And why the clinical anatomy of the lung is important in the last point is in understanding that why abscess are more common in some segments, like the posterior segment at the right upper lobe and the apical segment at the right lower lobe. Thank you, students. I hope you will understand the lecture. If you have any query, then you can put comment on my video. We will get back to you in new session with new video.